Assalamu alaikum wa rahmatullahi wa barakatuh. I would like to welcome you to Saudi Society of Emergency Medicine 2017 Scientific Assembly. I choose emergency medicine because I love taking care of sick patients. We are the only field of medicine that work in a system against time to save lives, from the patient calling 911 until he or she get transported to emergency department to receive a resuscitation, stabilization, or admission, and then he or she get transported back home.
I choose to be an ER physician basically to save lives. ER physician, he's the right person in the right place to save the patient's life on the right time. In our community, the trauma is the leading cause of death. And most of the trauma patients come to the ER where all necessarily procedures and life-saving treatment done by the ER physicians. And that's what our community really needs. The demand and the needs for ER physician is very high, and still the emergency department, most of the emergency department is not well established or well developed.
Well, it's funny you should ask me that. I never chose to become an emergency physician. It just happened. I was looking for a job after I graduated and there was an opening and I joined the department and I fell in love with the work in emergency medicine. But if I would want to express how I feel about emergency, I would like to express how I feel about becoming an EMS physician, because that came by choice. When I started learning about emergency medicine, I fell in love with the work of EMS because it's not pure clinical. You do some clinical and medical work, but at the same time you do administrative, education, quality, and on top of that, operations. So you combine the beauty of both worlds, medical and non-medical. And I think I made a good choice, and this is why I became an emergency physician.
Emergency medicine is a unique specialty. It's a fast-paced, team-oriented specialty where you interact with many different different healthcare providers. Emergency medicine where you make a tremendous or have a tremendous impact on many patients. Emergency medicine, I would say, or emergency room, I would say it's a safety net, part of the healthcare system in our country, where many of our patients, they doesn't know where to go when they looking for any medical care, so they will step to emergency department. We are, as emergency medicine physician, we are a diagnostic. We are seeing a variety of patients of different age group. We see babies, elderly, pregnant patients, psychiatric patients. We manage or deal with most of the different medical and surgical illnesses and injuries. We don't have a routine schedule. We have a flexible schedule, although we work in most of the weekends, most of the Eids, school vacations.
So why to choose emergency medicine? Emergency medicine is the field of excitation, is the field of saving lives. It's been said all the time that emergency physicians save lives, and we really do. An example, we have a patient that become unresponsive and you shift, you find hypoglycemia, you correct this, you saved his life, as simple as that. Many other patients, trauma patient, cardiac patient, all other pathology. So, emergency medicine can be also the most important or the most exciting 15 minutes of all other specialties. So when you're talking about emergency medicine, we are talking about a physician who is a master of resuscitation, master of diagnosis. We have the challenge of having patient with undiagnosed, patient with no history, patient with sometimes we don't have even people attending with him. So it's our job, our duty to find out what's the patient complaint and how to save his life in few minutes. We don't have that luxury time of having patients full history, all record.
I consider emergency medicine as a challenging specialty, and when I first did my internship, I really did not know which specialty to choose, and I saw that emergency medicine is the field that covers all specialties.
why emergency medicine? Why not emergency medicine? In emergency medicine, we see the life-threatening conditions of all specialties. There's no routine. Every day, there's something different.
So to answer your questions why I chose emergency medicine, I have to go back 14 years back when I start to think what to choose, which specialty I will choose. So that time the emergency medicine was as a new specialty in Saudi Arabia. So I decided to go through it, and day after day I discover myself in that specialty, and I like it. Every day passing, I like it more, and I never regret to be an emergency medicine physician.
Why did I choose emergency medicine? Every day in emergency medicine is a different day. Every shift is a different shift. You start your shift without knowing what you're going to face tonight or today. Plus, it's a very rewarding specialty. That adrenaline rush and that euphoric feeling after doing or helping a patient is priceless.